Hi, I'm Mr. Rosengrant, and we are here today with Dr. Justin Krupp, Doctor of Family Medicine. Dr. Krupp, thank you for joining us today.
Yeah, thanks for having me, Bill.
As a high school counselor, um, one of our roles is to try to help students figure out what they're going to do after high school and provide them with information that they can use to kind of figure out what career direction that they want to go in. In this video today, we want to talk about the medical field, and this is for students, high school students that are interested in something within the medical field. And one of the things that we really strongly encourage students to do is to do a job shadow where they can get hands-on experience, where they can see for themselves a day in the life of someone in that career and talk to an expert that's in that career. But right now with the COVID-19 pandemic going on, it's been really difficult for students to be able to get job shadow opportunities. So that's why we're doing videos like these with experts in the fields to get more information. So one of the things that high school students get a little bit anxious about, particularly the closer they get to graduation, is they worry that they don't have their whole life planned out. They don't know what they're going to do after high school, and they feel like all the other students have it all figured out. But the truth is, most of them just haven't had enough life experiences and haven't had enough different jobs to really know exactly what they want to do. And that's okay. I try to encourage them to have fun with the exploration process and learn about different colleges, learn about different careers. Um, and what I find is, although there's a few students that sort of know what they want to do early on and they go right down that path and they end up getting into that career, but what I find more often is as students learn different things and get different experiences, their path kind of gets unraveled as they get into different opportunities, take advantage of different opportunities. So one of the things I like to ask people first is, what got you into the medical field? What path did you take? Did you always know that's something that you wanted to do? Or were there sort of life experiences that led you to the medical field?
Well, yeah, it's a good question. So I didn't always know I wanted to be a doctor, but I did like the idea of being a doctor. I actually kind of fell in love with the idea when I was sick. I actually had a funny rash. I was sure I was going to die, and I went into the doctor and walked in there as this young doctor, and he says, "Okay," so, talk to me a little bit. Comes back, shows me a picture in a book, says, "You have this, you're going to be fine." And I was so relieved I was going to live, and that was just a benign rash that was going to go away on its own. And I was like, "Hey, I like that. You can help people, um, make people feel better. You get pays well." So that was kind of when I said, "Oh, maybe I can be a doctor." And so as I went to college, I kind of went through some of the pre-med courses. So at colleges, they'll often have like a pre-medical advisor. And so if you think that's something you're interested in, you can meet with them, and they'll have a lot of introductory classes to see if you like that. The other thing I did was I got training as an EMT, again, to see, hey, I think I like medicine. Here's something I can do. I can go get a side training, do a course, and start working as an EMT and say, hey, maybe I like that. So that was kind of my start into medicine. While I was in college, still, trying to figure out if that's what I wanted to do. As I went through those courses, I got a different job as a EKG tech. And that job allowed me to work in a hospital in all the different areas of the hospital. So from operating rooms to the regular patient floors to cath labs, I was running around the hospital doing EKGs on. And so I got to see a whole range of medical experiences doing that job. And based on those experiences of some of those other jobs I got that were in the medical field, I said, yeah, I like this. I want to learn more. I enjoy studying it, and I enjoy helping people. So it's kind of a win-win.
So it sounds like you're in the category of people that sort of figured it out as you went along, as you got experiences, you had your own personal life experiences that kind of introduced you to medicine, and then you, through college and the things you learned in college, you sort of went that direction. You mentioned about pre-med advising. So um, some students don't fully understand what that is, I think. So you actually declare a major typically, like
Mm-hmm.
biology or some other major. I guess it can be just about any major. You don't have to necessarily be a biology major. But different colleges offer different opportunities, and some colleges have pre-med advising. And that's where you would have a counselor, kind of like a school counselor in high school, but it would be a college counselor that knows what classes you would need and knows how to prepare you for the MCAT test. And the MCAT test is kind of like in high school where you are taking the SAT test to get ready to get into college. While you're in college, you would prepare to take the MCAT that would help you get into med school. And we'll talk a little more about the process and the different parts of the educational requirements there. But I also wanted to talk a little bit about your military experience. So we did another video, and I can add a link to this video at the end of this video about that information about the benefits of joining the military. But can you tell me a little bit about your military background and how that helped get you where you are today?
Yeah. So when I applied to med school and finally got accepted, I saw the bill for med school, and I'm one of 11 kids, so I do not have any
Wow.
rich uncles or anyone to cover that cost. So I said, well, how am I going to pay for this? A couple options to pay for that. One was the military. And so they have a program, it's a scholarship program. You sign up and they'll pay for 4 years of med school, and you own 4 years once you're done with your training. So I applied for that for the Air Force and the Army. I was lucky enough to get both. And so I picked the Air Force. So while I was going through medical school, the Air Force paid all of my tuition, all of my books, gave us a living stipend. And between that and my wife working as a nurse, we were able to get through medical school without debt. And it took us places we never thought we'd go. So for my training, I went to University of Nebraska in a joint training program with Offutt Air Force Base, which was really cool because I could see we did all of our hospital stuff at the big civilian hospital. So it was a tertiary medical center. They're doing all kinds of things, trauma center, really, really great place to study. And then I could see the military side in our clinic time there. So I got, training in the military and then training from the civilian world. And then after that, I went and did my payback time period. So during your residency, you're kind of in a neutral zone. It counts towards your retirement if you stay in. But then you do your payback once you're a fully board certified physician. And I did my payback in Las Vegas, another place I never thought I'd live. But it was a great time. We made great friends. And from there, I deployed to Iraq and then also to Honduras. Honduras was a medical mission where we got to, we saw, I don't know how many people, it was a lot, but helped the locals there that the poor people didn't have medical care. We did a whole immunization and vaccination program there. And then of course in Iraq was also a great experience. We were there during a transition period where we got to teach the Iraqi medics and help them because they used to, well, before the war started, they had a good medical system, but that all collapsed over 10 years worth of war. And so we were part of rebuilding that. And that was a great experience as I traveled around Iraq and talked to different medics and was able to help them. Through that military experience, the military gives you a lot of training opportunities to learn skills you wouldn't necessarily be able to do without a lot of extra money. The military is always willing to train you. If you want to get trained in something, they'll send you for it. So that was great, from leadership to different procedures and things like that. And then on top of that, the friends you make when you deploy, I still keep in contact with them. And then also just in your work environment, it's a very unique person who's able to sign up for the military, willing to sacrifice family time and those kind of things for their country. So those people I still keep in contact with, and they're still great friends.
Well, let me just take a second and just thank you for your service. People like you that are willing to serve, it's what keeps this country safe. So thank you very much for that. And you touched on another issue that a lot of high school students are thinking about and concerned about, and rightly so, and that's the cost of college. So college is becoming increasingly expensive, as has healthcare. So for you and military, we talk in my video, military is not for everyone. Not everybody can get into the military.
Mhm.
There's criteria there, and not everybody is maybe interested in doing military, and that's okay too. But for you, military was something that helped provide access to the education you needed to reach your goals, and the training that helped you do that as well. So it is a great opportunity for some people. And kind of going along with that, some high school students ask themselves or doubt themselves, do I have what it takes to do this? So you talked about, sometimes you need some money to get into something that you're trying to get into, whether it's the education or the career. Or a lot of students maybe doubt themselves that they have the intelligence, or they feel like, well, to be a doctor, you must have to be a genius or something like that. So there are different, one of the things we talk to students about is kind of career categories and certain personal values and skills that match with certain careers. Like to be a doctor, you probably want to care about people and probably want to help people at least, right? Some kind of baseline
Yeah.
there. But what would you say about what personal qualities it would take to be a doctor? Do you have to be rich? Do you have to come from money to have that opportunity? Do you have to be a genius to be a doctor?
Well, first of all, Bill, you know me. You know I'm not a genius. You've seen me, so
You're a pretty
that
smart guy, but
that one's off the table right away. Um, you know, I would say qualities you need. Well, first would be hardworking. So, um, yeah, maybe the smarter, the valedictorians of the class, the number one classes, yeah, maybe they can breeze through some of this stuff. But if you're hardworking, you can do it. There's no problem there. Second, or first, I'd say is compassionate. Like you said, you need to want to help people. Uh, that has to be a driving factor because that's what your job is. People are coming to you, they're coming to you in need, they're coming to you in pain, they're coming to you hurt, and you have to have compassion for them to be able to help lift them up. So hardworking, you need to love learning. Medicine is always changing, and that will go for a lot of career fields. There's always new innovations coming out, and you have to want to learn that field that you're in. So if you love learning about medicine, then you will do great if you love it. And the last I'd say is dependability. Dependability. You have to be on time. You have to be there, and you have to be there ready to work. You can't come in halfway. And again, I'm sure that goes for a lot of jobs. But I think if you are hardworking, dependable, and you love learning that kind of stuff, you'll do great. You'll make it. Getting into school, you don't have to go to a expensive school to get into the medical field. Getting your generals and all those things at a more affordable college. That's one thing I noticed. I noticed when I went to medical school, we had people from the big name schools and no name schools. And just because the college you went to did not mean it did not correlate to who was at the top of the class. Whoever's at the people at the top of the class were the people who had those characteristics I told you that were hardworking. They loved studying. They loved learning medicine, and they were dependable. They were always there. So I think as far as money, that's not an issue. People always loan. If you get accepted to medical school, we talked about the military, but there's also something called public health service, and then also there's a program for rural and underserved. If you're willing to work in an underserved area, which can be a small town or inner city, there are plenty of programs that will pay back your medical school bills. So your loan. So
loan forgiveness programs. So yeah,
exactly.
some of those programs are like 10-year. If you serve, if you are serving in a public service type area for 10 years, you can get those loans forgiven. So
Yeah. Yeah. There's a lot of programs like that. And so I wouldn't worry too much about the money when you get into med school. I know it's hard to say. I mean, taking those loans out is scary, and that's why I joined the military, right? That scared me. But there are other ways to get those paid back. Um, so I'd say you can find ways. I don't have any, like I said, I don't have any rich uncles or parents or anything like that to help pay the way. I was the first person in my family to go into medical school, and so far the only one.
So your average student could do it, so long as they're willing to put in the work and put in the effort and have the right drive and want to help people and those things you talked about. And we'll talk a little
Yeah.
more about the process of getting into, what medical school's like. And I think the process of medical school kind of weeds out those people that really aren't that committed to it or driven, because it is such a commitment. The educational part of it is such a big commitment. You have to really want it to stick with
Yeah.
it, whether you're smart or average or whatever. But before we talk about that, I just kind of wanted to ask you, what are the general duties of a doctor? What is it like to be a doctor? I know we can't get in and do a job shadow, so this, but we'll try to do our best to kind of get some information from you on what does a doctor do and what's it like to be a doctor? What are the good parts about the job? What are the bad parts about the job?
Okay. Well, I mean, your specialty will matter. I'll tell you what my day's like, and that, and that's will be pretty close for a lot of physicians, but depending on your specialty, it'll change. I start my day off at 7 a.m. I do procedures at the hospital. I go and do those. After that, I go to my clinic. And at my clinic, I'll see patients throughout the day. I'll respond to phone calls from patients, lab results that come in from patients. I'll deal with insurance companies that trying to get my patients coverage for procedures, medicine, things like that. Also from the business side, there's a lot of questions about business making decisions about who do we hire, what is our next, is there a service we should offer for our patients, and then after that then I go home. Take call occasionally and call you. You respond to, sometimes lab work will come back that's critical after hours, so the laboratory will call you. You need to figure out what you need to do with the patient, give them a call, help them out. I used to do inpatient care, which means admit patients to the hospital and take care of them while they're in the hospital. And then when I did that, I would usually start my morning with those rounds, grab them during lunch again, and then finally at the end of the day before I went home, I'd touch base with the patients again. So sometimes you have long days, depending on how you choose to practice. So with family medicine, some people just see clinic. They don't do any of that hospital stuff. If you work for a bigger group, you don't have to worry about some of the business side of things. You just go see your patients. You take care of their results. You answer their questions. They'll call in. So, and then you take calls from other physicians calling about a patient of yours. So sometimes patients wonder why I run late, and that I promise I'm not at the golf course, and nor I haven't really seen any physicians anymore at the golf course. I wish that was my excuse. We're often taking phone calls that come from other physicians about a mutual patient that we're trying to help out. So I'd say between seeing patients, dealing with insurance companies, and doing paperwork has become a large part of medicine.
So is that the hard part of the job or the difficult part of the job, or what would you say is the part that most doctors sort of struggle with or have difficulty with?
I would say some of the number one complaints would probably be dealing with insurance companies. We know what the patient needs. We want to give them that, but they can't afford it. Their insurance doesn't cover that service. And so then trying to find ways to get them that service, whether it's a medication, a procedure, a diagnostic test. So that's a frustrating part when you know what they need. We have it in this country, but yet we can't get it to the patient. That's tough. The paperwork part, I don't think any physician likes. I don't think any job people are like, oh, let me fill out more paperwork with weird questions. We're like, patient's sick, let them stay home from work, right? And then electronic medical records, where we do our documentation. I think that's another large complaint for doctors, that electronic medical records are great because it's eliminated the problem of sloppy doctor handwriting. So that's a safety issue. So that's good. But the designers seem more bent towards, I call it the bean counters. So checking stats and things like that, which is useful and needed, but going through something that way, they still haven't gotten the user functionality down yet to where a lot of physicians like it. So.
And I imagine there's a lot of political and ethical issues too when it comes to that mix of, the doctor knowing what's needed and the health insurance maybe they're watching their own budget and only, allowing certain things to be done. And the patient themselves has to watch their own budget. So they have to balance, you know, what healthcare they can afford versus what they really need. And so I'm sure it gets very complicated and tricky with some of those things.
And we're finding more ways, and there's more groups stepping up and trying to find ways to make things affordable for our patients. I'd say the probably last thing that's difficult is um, there, when there's not a good answer for the problem the patient has. Let's say they have end-stage cancer. There's not a lot of good answers for that one. And those are tough times watching them go through that. Or we don't have a reason for their pain. We have a lot of diagnostic tests we can do, but we can't always find the cause of why the patient's hurting. We CT scan them, we scan them up and down and look for all these things, and we can't find a reason. So I'd say when we can't solve the problem is probably one of the most frustrating parts as a physician, because that's what we love to do. We love to solve the problem, get them feeling better, get them back to work, get them back home, get them back to feeling happy.
Yeah. And, we talked about, to go into this job, you have to have empathy and care about people and care for their well-being. But then at the same time, you're the person that's dealing with some of the most difficult suffering patients. So you have high empathy people dealing with high suffering people. And that can be, I'd imagine, emotional and challenging, and trying to find a way to mentally, come home and try to put that aside and get back to family things when you're home. And so all that, I'm sure, is a challenge for most doctors, I would imagine.
Yeah. Yeah, you definitely take a period to de-stress on the rough days. Just like any job, you have to take a moment before you head home, take a quiet moment, kind of recollect your thoughts. Definitely need to know what your stress relief is. So whether that's exercising, meditating, prayer, reading, watching funny cat videos on YouTube, whatever you need to do to de-stress a moment before you come home is always a good idea.
All right, so I thought we'd talk a little bit now about the educational journey that you take on your way to becoming a doctor. So can you break down kind of the different parts of that journey, and how many years you're in each part and what you do in each part?
Yeah, I think I was like 30 something before I actually had a real job, right? So you go through college. You want to, so that's your first part. You don't have to have a pre-med major in college. You can major in business, engineering, chemistry, art, whatever you want to major in, you can major in. And but you just have to take the pre-med courses, and those will be usually there's prerequisites for take the MCAT and for medical schools. And again, if you have a pre-med advisor, or if you just Google them, a lot of times you can find it if you don't have a pre-med advisor, but most schools have some kind of pre-med club at college. So you pick whatever your major is going to be. I would probably suggest, if you're going into medicine, if you pick a pre-med major, you'll do well a lot of your beginning classes in medicine. If you pick a non-pre-med major, it'll make you interesting also to have other experiences to bring into your work, right? So if one of the things I wish I had done, I was like, maybe I should have minored in business. Now with the group I'm in, that would be very beneficial. If I was in a larger group, probably not as useful. So depending on that, so that's one thing I like learning business and finance stuff. So after you get into college, you'll take those courses, you'll study for the MCAT, which is the entrance exam. And you can do that by, there's a ton of prep courses for that also, and ways to prepare for that test. It's changed since I've taken it, and it may change again, who knows, but those are very easy to find courses. Once you get accepted to medical school, I guess the process of applying to medical school, maybe I'll talk just a little bit about that. So you'll send out an application. You can search what the average student at a medical school is. There's back in my day, it was a book. I'm sure now it's online resources, but it'll tell you the average age, GPA, MCAT score, and different demographics for which schools you're applying. So once I got my MCAT score, I looked and said, okay, which schools would I be competitive at? And I made sure I applied to those schools. The ones I wasn't even close to, I wasn't going to waste my money in applications, because again, they're expensive to apply. You'll send your application off. They'll probably send you what's called a secondary application, which again is another fee, and they'll ask you more questions about yourself. After that secondary application, you get, if they want to, they'll ask you for an interview, and then you'll fly out to whatever college, med school, and you'll do your interview process, and then you'll find out if you got accepted. Once you're accepted in med school is 4 years. After you graduate med school, you will do an internship. That's kind of your first year as a doctor is called an internship. It's usually tied to your residency. Residency and internships are usually your specialty training. So if you wanted to be a surgeon, you would do a surgical residency and internship. If you wanted to be a family medicine doctor, you do a family medicine surgery or surgical internship and residency. And whatever specialty, all have their training. That time period will range anywhere from 3 years to 8 years, depending on what you go into. So if you want to be a cardiothoracic surgeon, you're looking at closer to 8 years. You'll do an internal medicine residency, and then you'll go to what's called a fellowship. So that's even higher training. So there's a wide range. If you want to do emergency medicine, that's another residency. After you complete your residency, I guess one thing I should say, during internship and residency, you do get paid. The hours I had to work, I think I made about $8 an hour because we worked 80-hour weeks, 36-hour shifts at times. So those are some long hours. I think we made less than someone who, anyway. Yeah, we did not make a lot per hour, I would say, but they paid us. And again, everyone did fine, right? And then after your residency, you then do your job. You're a fully trained physician, and so you apply to a job wherever you want.
So you got 4 years of a bachelor's degree, 4 years of med school, and then you have your internship and residency, which can range from 3 to 7, depending on what specialization. And there's a whole bunch of different specializations. And during that time, from what I understand, you get a chance to sort of sample a couple different fields. That's kind of part of that education. You have to try a few different things. That way you get some well-rounded experience, and you can really kind of be sure about what direction you want to go with medicine, right?
Right. I mean, your last 2 years of medical school, you will do rotations in a lot of fields. So I'd say that's probably where you want to do most of yours, because by the time you match to a residency, you want to be sure. But I've had friends, his last rotation of medical school was ophthalmology. He had already matched in the military to do family medicine. So he did. So the military is living. Once you kind of match in the military, you're stuck. You're not messing around. So he did his military family medicine residency, did his payback for the military, then went back to ophthalmology school. So there is kind of an optimal time frame to really figure out what you want to do is kind of your 3rd year of medicine. You want to be pretty sure, and then you confirm it your 4th year of medical school. And then once you're in your residency, you kind of want to be pretty sure. But after your internship, you can change, and plenty of people have changed in their internship year to a different residency. At the end of your residency, that's when you take your specialty boards, and then that's where you're board certified. So if you do a year of internship, you could practice as what's called a general practitioner in a lot of states. Okay. And just kind of do general practice.
Next thing I wanted to ask you about is, what's the difference between a MD, medical doctor, or a DO, doctor of osteopathic medicine? What are those things, and how do you know which one to do?
Well, when they first started, there was a lot of difference. When the doctor of osteopathy was started, I think medicine was still giving mercury to patients. So they said, well, let's do more manual medicine, try and improve blood flow. You got a sore back, we'll adjust your back, and kind of a more holistic approach. As evidence-based medicine has progressed, those two groups have become very close. For example, I did a DO medical school and I did an MD residency. So I've got both levels of training. So the medical school part, I'd say the easiest way to kind of summarize it is, if you go to a DO med school, you're going to learn a little bit more manual or hands-on medicine. Someone's got a sore neck, I'm going to know how to stretch you out or maybe adjust your back, some of those type of things. If you go to an MD school, you might do a little bit more research or publications. in that same time, because you still got to learn the same stuff, right? There's still only really one, there's evidence-based medicine is what the push is. And so they've actually started to join. There used to be a different application for residency of a DO residency and an MD residency. And now they've actually joined that process. That's how close it's becoming as far as medicine goes. So I would say check them both out, see which ones you like better. But you won't go wrong with going to either of them.
All right. And as we're talking to high school students, if you think back to when you were in high school, what do you know now with the experience that you have that you wish you knew? What would you tell the high school you about medicine and about your career?
Don't skip typing class. We had a typewriter and I skipped it because I was gonna be a doctor. I was like, oh, yeah, maybe I'll be a doctor. I scribble something on a pad and walk away. So don't skip. Be good. Everything now is on the computer, but they're probably better at computers than I am. So that would be one. Number two is figure out what you like. And I think that's part of just life is figuring out who you are, what really brings you happiness, what really excites you. There's so much out there. And as you find truly what brings you true happiness, what things you really like to do, your career choices will be clearer. And even as I was going through the process of figuring out what I want to be, one of the reasons I chose family medicine is, well, I liked a little bit of everything. I liked a little bit of delivering babies. I liked a little bit of hospital work. I liked a little bit of procedures, and I liked a little bit of clinic. So I still haven't figured that out. I'm still figuring that out. So, but I do know some things now about more who I am and what brings me happiness, what are some of my true strengths and what are my weaknesses. And working on those. So I think taking some time to really look at myself and say, who am I? What do I like? What do I really like?
I mentioned earlier that part of the reason why we're doing these videos is because of the COVID-19 pandemic and how that's changed my role. And I am kind of forced to find new ways to deliver these services to my students. I wanted to ask you, in the medical field, how has the COVID-19 pandemic impacted your job and made changes for your job?
Yeah, well, it hurt a lot of practices as people weren't coming in, and we had to adjust to telemedicine. So telemedicine, some people did it. There was initially a steep decrease in reimbursement for doing telemedicine, and so a lot of people didn't do it because you didn't have a good enough margin on it. But with that, luckily they passed a rule saying, hey, we'll pay it as a regular visit. And they kind of threw away all the barriers. So seeing a patient kind of like we're doing now through trying to help a patient that you can't put your hands on. I have a lump here. Well, part of our physical exam that we spent years on was, okay, what does that lump feel like? How big is it? So that's been kind of taken away. So that's been tough. But we've worked around it, and patients, some of our older patients, it's been tough to kind of get them set up, to get it to work. Getting them on a video chat is tough if they don't have a kid who comes over and kind of helps them set it up. But we've been working through that and trying to make sure we don't have as many discrepancies in care. But not everyone has a computer. Not everyone has access to internet. And reaching out to our patients who may not have those resources has been a unique challenge to figure out how do we make sure they're still taken care of. So I'd say decreased reimbursement, which a lot of businesses have felt. Changing in how we do business, from getting supplies to policies of, hey, how do we take care of sick patients? Because a lot of businesses say, hey, you're sick, you can't come in. Well, the doctor, that's a little different, right? So how do we keep our staff safe? Because we have staff who have medical conditions or family members who have high risk conditions, and trying to ethically protect them, take care of patients has been kind of a balancing act. And I think we've gotten better at it, now that we're about a year into it or whatever. But
And I saw you had a picture of you receiving the COVID-19 vaccination. So what do you want high school students and staff like myself that work in high schools to know about the COVID-19 virus and about the vaccination?
It's just like any other vaccine. So they've been working on the mRNA vaccine since 1990. So this is not a new vaccine. Now it's hit the news because they had a breakthrough shortly before COVID came out. If you look at the last 10, 20 years, we've had outbreaks of coronavirus type illnesses. So this illness isn't knew that it's been a problem, right? We've had SARS and MERS and a couple other ones that are coronavirus based that have come out and caused significant problems. So they've been working on this for a while. Um, the amazing thing, the technology we have is that they were able to genetically sequence this virus. So China, when they got it, with our DNA sequencing, so we took it down to science, and they can make a messenger RNA vaccine, which is the blueprints or instruction sheets, right? Before we used to have to grow things in cells, and it took a while to make things. Now we can manufacture the messenger RNA. So that was part of it. The other part I wanted to know is that people say, well, they must have skipped a lot of steps. Well, the steps, what they did is they got rid of the red tape. They said, look, you can do stage 1, stage 2, and stage 3 at the same time. Versus before, you'd have to do stage 1, collect all your data, present it, wait, get approval, submit for stage 2, wait, get approval, do stage 2, and so forth. So that was an amazing time saver. The other is, to prove something is safe and then prove something is effective. Well, safety is pretty easy to prove. You give it to a bunch of people and make sure they don't die, right? Okay, so that didn't kill them. So that's good. There's no deaths in the vaccine trials. There were some allergic reactions, and we're seeing some allergic reactions. In the efficacy, usually it takes a long time because you don't have a worldwide pandemic. So let's say you're trying to make a vaccine for measles. Well, you got to find somewhere to prove that has measles to prove the vaccine works. So there's all those kind of logistic things were taken away because where's the hot spot? Okay, well, now it's everywhere, right? So it's easy to test and see if it works. So it's safe and it's effective. I've gotten both doses, and in the medical community, a lot of my friends have been vaccinated, and you have about a 25% chance of having some side effects: sore arm, achy, tired, stuff like that. Now there are those cases where some people had allergic reactions. So if you carry an EpiPen, things like that, you want to talk to your doctor before you go through that, and maybe you might be one who holds off on getting that vaccine. But if you don't have severe allergic reactions and you've gotten your other vaccinations, you haven't had any problems, you're going to be fine. And I would suggest getting it. So, people may say, well, I have a lot of people, they're young. They're like, well, I'm not going to end up in the hospital. I'm 18, I'm 25. I'm not going to end up in the hospital. And I said, well, what's it cost to miss 2 weeks of work or 2 weeks of school? Or what if, what about your grandparents? Or, what if you feel okay because healthy young people have very mild symptoms majority of time, but they can still pass it to your more fragile patients, your grandma, grandpas, or your patients who maybe are immune compromised because they have cancer or something like that. So that's part of the herd immunity idea. So we often immunize people who, hey, you're actually not a high risk of being in the hospital or dying from this, but you could be a spreader. So we're trying to get rid of that too. And so I'd say for our young people, at least here in Utah, for the last few months, our large amount of our spreaders have been our people ages 15 to 24, because, well, they're young and healthy and they're invincible, right? Because we all were at that age. So that's what I'd tell them, is try and just do their part. They can't control what happens in the whole world, but they can control what they do to make the world a little bit better, a little bit safer. And I'd say getting this vaccine will make the world safer, help the economy come back, help things return back to a sense of normalcy.
Well, Dr. Kropp, thank you so much for joining us on this call and telling us a little more about the medical field and a little more about the COVID-19 vaccination.
Yeah, anytime.